Hi everyone, my name is Dr. Pavan Sagar. I am a practicing homeopathic physician from Tumkur, Karnataka, India. Today I am making this video as a lot of my patients were inquiring me about the recent health condition Mr. Rajnikant, the actor, has been diagnosed with. So recently, as we all know, Mr. Rajnikant was diagnosed with aortic aneurysm. So let us understand what is aortic aneurysm. So to understand what is aortic aneurysm, we need to first understand what is an aorta. So the aorta is the main artery that supplies oxygenated blood, that is blood which is rich in oxygen from the heart to the different parts of the body. The aorta is 1.5 centimeters to 1.7 centimeters in its thickness, so it is quite thick, and it moves from the heart going up, becoming the ascending aorta, and then arching the arch of the aorta, and then it starts moving down, becoming the descending aorta, or also called as the thoracic aorta, and then it moves downwards, becoming the abdominal aorta. So now let us learn about the aortic aneurysm. So aortic aneurysm is an abnormal dilatation of the aorta. So the aorta is abnormally dilated. So dilatation is becoming big, expanding. So it is abnormally dilated, and there are several reasons for why the aorta becomes enlarged or dilated. So this can happen either in the thoracic aorta or in the abdominal aorta. So let us look into the reasons for which the aortic aneurysm happens. So the first and the most common cause of the aortic aneurysm is called as the atherosclerosis. So atherosclerosis by itself is a big topic, and I am not going to discuss about it right now. So if you are interested in knowing about atherosclerosis, you can definitely let me know in the comments, and I'll make a separate video dedicated to atherosclerosis. So apart from atherosclerosis, there are several lifestyle problems that we have, that is high triglycerides, high cholesterol in blood, smoking, diabetes, eating a lot of processed foods. So these are a few common causes which are leading to aortic aneurysm. So the aortic aneurysm, it is more common in males compared to females, and it happens in people who are above 60 years of age. So now we've learned about aortic aneurysm. So this is like a basic understanding about aortic aneurysm. So what happens in an aortic aneurysm? It is basically like you blow air into a balloon. So the air, when you blow into the balloon, it starts expanding the balloon. At one point, the balloon is so big that if you push in more air, the balloon is going to burst. So that is what happens in the complication of an aortic aneurysm. So the aortic lumen, it is so big already that the increased amount of pressure ruptures the aorta. So the aorta breaks. It's just like how I gave an example of the balloon. When the balloon bursts, the air inside the balloon moves out. So the same way, when the aorta bursts, the blood which is in the aorta, which is being supplied through the aorta to the different parts of the body, it starts moving out. So when the blood starts moving out, the person who is having aortic aneurysm, the rupture of the aortic aneurysm, will start experiencing hypotension, that is low blood pressure, along with severe abdominal pain in the stomach region. So the patient experiences severe pain in the abdominal region or in the flank. Flank is this part, this portion, we call it as the flank or the back. So these portions, the patient starts experiencing severe pain. As we all saw on the news, even Mr. Rajnikant complained of severe abdominal pain, due to which he was rushed to the hospital. So aortic aneurysm, once it has ruptured, it is a serious condition. The patient has to be admitted to the hospital and the patient has to go through the surgical procedure which is required to rectify the aortic aneurysm. If not, it can lead to death in a few hours. So that is how serious the problem is from the aortic aneurysm. So how can you tell if you are having aortic aneurysm or not? So the first and the most important thing is aortic aneurysm is asymptomatic, meaning there are no symptoms. In majority of the patients there are no symptoms. But if you are concerned that you might be having an aortic aneurysm, you can definitely go and get an ultrasound scanning done for yourself to evaluate or for diagnosis of the aortic aneurysm. And in majority of the cases, the aortic aneurysm is seen only accidentally, meaning the patient has gone in to get an ultrasound done for some other complaint, and accidentally we have found that there is an aortic aneurysm. And in majority of the cases, the aortic aneurysm is noticed only when the rupture has taken place. So because of the rupture, the patient experiences severe pain in the abdomen followed by hypotension, that is low blood pressure. So these are the few warning signs that are telling us that the patient or a family member of yours is probably suffering from aortic aneurysm. So how do we manage this aortic aneurysm? That is the next question. So the endovascular surgeons, what they do is they either do an open aortic aneurysm surgery wherein they graft, a prosthetic graft is used, and in other cases where the minimal invasive surgery is involved, a stent, a graft stent is inserted through the femoral artery. So from the thigh, from the groin region, a stent is introduced into the femoral artery and they make it reach the abdominal aorta and the stent is placed. So through this, again we are able to re-establish the blood supply and the person is healthy again. But the aortic aneurysm is a condition which needs to be given a lot of care because it is hidden, meaning it is asymptomatic. Nobody knows, like we can't really tell that a person is having aortic aneurysm just by looking at them. So that is a difficult thing. So the best thing is, if you are obese or if you are a chain smoker, person who's been smoking for many years and you're above 60, 65, it is always recommended and it is a good thing to get an ultrasound done once in a while, maybe once every 6 months or once a year, just to make sure that you are not suffering from aortic aneurysm. So I hope I have explained about the aortic aneurysm and how it is caused, what happens in an aortic aneurysm, and how to find out about an aortic aneurysm. And if you have any questions related to aortic aneurysm or any other condition, you can definitely let me know in the comments below and I'll be happy to answer. Thank you.